Begin. Just a quick welcome to all of you. My name is Halldór Elís Ólafsson from Promote Iceland. I will be your moderator today, calling you from Tokyo. We have with us ISKU, Vetrospace, and Protetiko today. We were supposed to give you 3 minutes, but I think I will be a little bit relaxed on you going over. So if you want to add something to your presentations, I think you're free to do so. Questions can be posed in the chat box, but since we have, I can unmute also Miss Sarah Hu, and she can also then pose her questions directly to the panelists if she would like to. But without further ado, Jonas, if you would like to go first, you can then share your screen.
Yeah, let's do so. And actually, Sarah is also with ISKU, so she's our chief representative of our Asia Pacific markets. And let me share the screen. I lost the button. Oh, there it is. But yeah, let's go through our concept. So as mentioned, we are developing our antimicrobial concept where we are embedding technology in our furniture manufacturing, and this is basically the key thing what's happening in our on the surface on the microbial level. So you can see that, for example, in this setup, we have E. coli bacteria on the left-hand side. We don't have any kind of treatment on the surface, but on the right-hand side, we have this BioCoat silver ion technology treatment. And you can see that during 2 hours, we can see clear difference that on the left-hand side, the bacteria population can reproduce and it can survive, and on the right hand side we can see that that's the total opposite, so it cannot reproduce, it cannot survive. And we are using 3 main technologies, as mentioned, BioCoat, which is based on silver ions. Then we are using a lot of fabrics in our upholstered products, so you can see that we are using ISKU microbe shield technologies in those fabrics. And then we are using brass. So in brass, we are using EPA-approved copper alloys only, so those kind of brass qualities. So that's based on copper ion technology. And these are all permanent features, so you don't need to renew them, and the lifetime is there as long as the furniture. And value proposition of this concept is for healthcare sector, it's less infections, faster patient flow, faster passage, and efficiency. And same goes for work environments, but through sick leaves and absentees. So less infections there as well. This is considered to have really short payback periods. So when we are talking about sick leaves and infections in healthcare segment, especially. Couple of reference photos. So this is Children's Hospital from Istanbul. So we don't need to jeopardize design or colors. Helsinki, Finland, newborn hospital. Central Hospital in Lahti, so corridors, lobby areas, canteens, so we can furnish places really holistically. One example of brass-coated tabletop, so that kind of brass-coated workstation. And we have also references in Singapore. And if I got your attention, please contact us. Thank you.
Thank you, Jonas. I think we can either take questions now or do it after, but I think since we have Ambassador Vanska here, I would be amiss to not allow him to ask the first question. Ambassador, do you have a question for Jonas?
I don't know, maybe not really a question, but I just want to say that I'm pretty impressed by your products. I don't have any own experience of using them, but by what I just saw, it's amazing that these type of things can be achieved through furniture. And since I also know sort of the history of the company of ISKU, a very traditional Finnish company, well established, so I think we have all reason to have high hopes for the further success of your company. So I'm just wishing you all the best, and eager to hear more, and also eager to to hear more then in the future how you're doing here in Singapore. So
thanks a lot for this shout out. Thanks.
Thank you, Ambassador. I would like to give it now over to Marco at Vetrospace for your presentation. Marco, is that okay?
Yes.
Then please go ahead.
You should see me presentation at the moment.
Yep.
Yeah, because this is more like a casual gathering now, so I maybe introduce myself shortly. I live in Singapore, but actually I'm now in lockdown in Finland since March. And I have done businesses in healthcare and waste sector 30 years and last 12 years in Asia. And my journey with Vetrospace started like a half year ago because Indonesian government contacted me. They have saw the video about Vetrospace from Finland. And so we started, and now I have open market to Singapore, Japan, Thailand, and Indonesia. But the company Vetrospace is founded years ago, but they make a dividers on the office spaces. But since 2017, they have manufactured ultra-clean modular soundproof pods. And the latest patented system was a controlled microenvironment, CME, which was launched in Medica in November 2019 very successfully. The CME technology is integrated into our pods, destroy viruses, bacteria, and other harmful particles into air and surface with the pod safely and efficiently. Okay, and now, yes. And as ISKU, we are a bit similar, that what we are doing like a pods, it's not, maybe we can cooperate in the future because we need the furniture as well inside the pods. But also our system is, the three critical factors are needed, that there is a air purifying ventilation, then there is a special coating on the surfaces, and antimicrobial lighting. With these three combinations together give you a 100% sure that 99.9% of the viruses and bacteria is destroyed. Our biggest order in Finland at the moment, 70 units in a hospital, and we started a couple of weeks back in a maternity ward in Helsinki University Hospital. We can use these pods, many places, like, as I told earlier, hospitals, transportation hubs, like ferry terminals, airports, different kind of offices, universities, and government offices, and banks. There are some references. We have delivered at the moment in US, different countries of Europe. Now we are starting our operation in Asia. This is a picture from Helsinki University Hospital, which we have delivered a couple of weeks back. And after 2 weeks use, they said that they need more. This is a picture of a maternity ward. And there's an idea that when you come to child, going to get the child, you go through like a path. It's like a path in, and you can get out with the baby in our system. We have delivered University of Oulu and also in Paris, some of governmental offices in Finland and Europe as well. Transport hubs, we are under negotiation in Asia as well in US. And it's not only a bot, it's a whole solution together with these three factors, what I mentioned earlier. And if you need more information, I'm the contact in Asia, and then Mr. Jonathan Cole, who's based in Finland, and also answer the questions. Thanks.
Thank you, Marco. I will open up maybe if you have any quick questions now, otherwise we can do a little round at the end. If there's anything now. If not, then I would like to ask Joachim from Protetiko to share his screen and make his presentation. Joachim?
Okay. Yes, hello again. My name is Joachim Fong, CEO and co-founder of Protetiko. And of course, as I said before, we're in the dental industry with our customers being dentists and dental labs that work with dental prosthetics. So that means when they work with crowns, bridges, dentures, veneers, and so on. And they want to have a patient, high quality, low cost, and so on. But the problem is that almost all orders for dental prostheses are made with pen and paper-based processes, such as you see on this slide here. And this causes a lot of problems with the production, delivery, waste of materials, and most importantly, waste of time for the dentist and the lab, and the patient who has to come back more times than necessary to the dentist chair. So we built a cloud-based solution, a platform that allows dentists and labs to connect in real time and manage their orders with an efficient workflow. And we automate and simplify the order process. And by this, we can avoid errors and wasteful manual routines. So our solution brings transparency, efficiency, and security to the dental industry. And we're also an integration platform that integrates a range of different services and tools so that our customers can have a single place to manage their workflow. So for clinics, Protetiko helps to optimize working routines and helps them manage cost and improve quality, and in general, provide a better patient journey for all involved. For labs, we help them optimize workflow and delivery processes, but our main customers are large size organizations, both on the clinic side and on the lab side, where Protetiko helps to streamline operations and optimize workflows. And we also provide a great platform for data mining. Our founding team comes from retail, manufacturing, and logistics, and we brought many ideas from innovations from those industries into the dental space, such as lean and agile. As I said, Protetiko is an integration platform, and this is an example of an integrated flow where Protetiko is connected to several systems used by clinics and labs, such as general systems and intraoral 3D scanners. Maybe I should have changed 3Shape to PlanMeca or PlanDent, since we're working with them. And we also work with another Finnish company called Dental Mammoth, so special now for our Finnish friends. So we assist dentists and technicians through the whole order and production and delivery process. This is an example of how to create an order, and it works both with traditional impressions as well as scanned ones. And our design tools are great for discussing patient cases before an order is actually placed, and can also be used as an educational tool. And here we can see some examples of how you can track the order process and get real-time overview of the current status of the order. And our analytics suite allows for detailed data mining. It's possible to drill down and find bottlenecks and understand KPIs on many levels. And for the lab, we provide a range of tools such as team and production management, invoicing, and so on. And finally, we also provide shipments and tracking. So we're Protetiko, the new standard in dental order management. Thank you.
Thank you very much, Joachim. We now have a few minutes for some questions. I invite you all to ask each other questions if you have any questions. And Mr. Ambassador is still on the line. If he has any comments or questions to the panelists, to the program itself. We are now at the end of this very strenuous virtual program, the first that we did with Nordic Innovation House. I think it has been a big education for all of us in the Nordic Innovation House team. So I'm pretty sure that this sort of virtual market entry is here to stay. Any questions to the panelists?
If I may again, and actually, again, I do not really have well, maybe I do have a question, but first I want to say that as you can imagine, embassies are probably not the most obvious sort of target groups for the line of products that you represent, but anyway, it's really interesting to see the development in that sector also, and I'm happy that we have such a high range Nordic selection and Nordic companies to offer. I would like to ask, of course, about this pandemic at hand right now. Your companies have been there before the crisis, before Corona hit the world. But how has that affected your business? I guess most companies, or a lot of companies in the world, have been heavily suffering from the crisis. But how is it in your case? What's your situation now compared to the situation before the Corona crisis?
Jonas, you can go first.
Yes, thanks for the question. Of course, we are operating in multiple business areas. We are operating in B2B, but B2C also as well, and in multiple markets. So we are seeing a lot of different kinds of deriving effects of this situation. Overall, I think the effect is negative for us, even though we have this kind of antimicrobial concept. In regards to this concept, of course, it's raising more questions towards us, and so. But this is unfortunately today not the main thing that we are selling and promoting. So they are like odds and ends for us, and that's pushing us to reorganize our doing, and it's also pushed us to operate more digital way, and there are all kinds of like effects going on regarding this situation, but overall the situation has been a bit negative, I would say.
Thank you. Marco, would you like to comment?
Yeah, I have to say that somehow this pandemic have developed a lot of inquiries, and we have got quite many. But in the other hand, when you go to the negotiation phase, and if I'm talking about those ministries level and disaster management, like in Indonesia, we are very close on the deal, but I still feel that the face-to-face meeting are the best. So inquiries we have got a lot, and then we are very close, to close the deal, but something missing. Like I try to get a special permission to go Jakarta, but then they afraid that I have to go some kind of tent village to a 2-week quarantine and things like that. So a lot of positive inquiries, but the other hand, you can't really do only video conferences, and normally it's not enough.
Maybe twist the question a little bit around for Joachim. How has it been? I mean, the attitudes toward digitizing something that has been pretty analog. Is there an attitude shift in the dental space?
I think the crisis has not changed the attitude. Everyone in the dental space realizes that they really need to start digitalizing their processes. For us, the crisis has had an impact in such case that dentists across the board have pretty much closed down. They only work 50 or 40% and are only now starting to get back to working full time. And of course, this has the impact that there's a great debt in treatments. So obviously people need to go to the dentist, but they have postponed their visits, which means that there is a lot of pressure now on both the clinics and the labs to deliver. So for us, the only impact has been that it's delayed our rollout, but getting new business and so on, that has not changed much, and the need is still there. Could actually be of benefit for us because somehow it's easier to connect to some of the larger organizations now that everyone's used to video conferencing.
Yeah. Thank you. I had a quick follow-up question to both ISKU and Vetrospace about sort of where will antimicrobial research go from now? Is there going to be a big funding push into this sector? Where will this go from here after post-COVID?
Yeah, if I may go first, the situation is that sense really interesting to us since we have been developing this same concept for the past 7 years. And before the pandemic, like talking and discussing about this concept with, let's say, with work environment operators or normal companies, that wasn't so important to them. Of course, in healthcare sector, this has been always on the table: infection control and reducing risks of infection. That has been always on the table. But on normal corporate side, that hasn't been so important. But now the mindset has shifted totally, and we have more ears listening. And where we are comparing this at ISKU is, if I may provide really practical example, that's height adjustable table. That used to be like nice to have thing that you can raise the table and stand part of your work day and so on. But when corporations, they realized that you can actually reduce sick leaves, do back pains and injuries and so on, then they became new normal. And with this antimicrobial concept and with these infection control measures that we can provide with furniture to normal working environments, the effect might be the same. And that's something what we are pushing forward.
Thank you, Jonas. Marco, would you like to add to this? Are you sensing a sort of a trend towards putting more money into research in the field? Not just.
Yeah. Yes, actually, I agree totally what Jonas just told us, and in our case, there has been quite many inquiries and areas where we can, adapt our technologies, and car industry and comet industry, and those are pretty exciting. And we study about those possibilities, and we are going to make our decision very fast. But according this week, what has happened, I was first a little bit disappointed, not so many connections, but finally we get like two, and one of those already offer us innovation collaboration in Singapore in a hospital level, and we are very excited about that. And that means that there is some money and funding for health tech after the pandemic. So
thank you, Marco. Anything to add here? I had one question to you, Joachim, about sort of the time it takes to implement the system. Let's say in a relatively small practice, how long would you take to implement a system that you are offering?
Oh, it varies depending on the size of the organization. If you're a small practice with maybe 1 or 2 chairs, it will take you half an hour to maybe 1 hour, depending on how quickly you can click through the solution and try things out. So it is very fast to implement. If you're a larger organization, let's say you're a multinational with hundreds of practices, if you just looking at the rollout rate, then it will take some more time, because then you have so many different levels of the organization that you have to take into consideration. But to set up, that's basically enter your details and you're up and running. On the lab side, it takes more time, because then you have to set up your production lines, teams, and all your price lists, etc. So there's more work done on the lab side. But for a dental practice, it is very quick to set up. No installation needed.
Okay. Thank you. I remember at the outset of when we were actually planning this virtual entry program, we thought it might be a good value proposition also for the companies to get to know each other. And I'm pretty sure that if we just look at this little breakout room that we have here today, it might be an idea to have all of you 3 working together and get a few other partners together as well, and set up an interesting test case in Singapore, perhaps. But if there are no other questions now, we still have a few minutes left, but if there are no questions, then I will end it here. And thank you all for job well done in the entry program itself. And we certainly hope that this has been not only a learning experience for us, but for you, but then develop the leads, and something good will come out of this. Thank you, Ambassador Vanska, for joining us here in the breakout room. I think that was a delight to have you here. But if nothing else, then I will wish you all a good weekend, and see you at the next virtual meeting.
Thank you. And if I may just say that I wish you all the best. And when the times are better and you're next time in Singapore, so please drop by at the embassy. Finns and Swedes and Icelanders and Norwegians, doesn't really matter, but you're always welcome.
Thank you
for the invitation.
All right. Thanks. Bye.
Thank you.
Bye-bye.
Okay.
Thanks a
Thank
lot.
you, everybody. Have a good day.
Have a nice
You
weekend.
too. Bye-bye.
Bye.
Yes.
Bye-bye.
Bye-bye.